Since it is October and Breast Cancer Awareness Month, the last half of the segment, we're going to talk to John about some of the symptoms and concerns that he actually came to my practice with, and some of the things that we did in diagnostic testing that we offer to help with these types of symptoms. We live in such a 24-hour town. Everybody's on a go, go, go. It's a stressful town to live in. We have kids. You may work night shift. You may work morning shift. There's some of you out there that may be even driving home from working a 24-hour shift or even working the night shift, swing shift, and how it really affects the body out there. And some of the things that you actually may experience: fatigue, sleep problems, hormone imbalances. And John, I really want to thank you again for coming on the show with me to share with you out there some of the type of symptoms and common symptoms that you have that also all of our listeners may have out there. And tell a little bit about why you first came to Vitality Medical and Wellness Center and some of the symptoms that you experienced.
Okay, you got it. This is an exciting topic insofar as with everything you described is something that it can relate to probably, I won't make up, I can't guess a number, but a large percentage of your listeners right now. And the reason being is that there's this kind of this confluence of events that come with adulthood that bring about a kind of a spiral to whereas age brings about maybe like loss of muscle. And then if you have any like personal events like divorces or that, anything that conspires to rob you of sleep or rob you of the drive to exercise and just, anything that causes failure to thrive, even if it's momentary, because even if it's momentary, you have to work doubly hard to try to recover. And as you get older, it gets harder to recover. So my experience was much basically in that vein. Prior to, I've got a job where sleep is difficult to come by. It's interrupted, quite regularly, and so consequently, I got kind of used to having particularly light sleep, the kind of sleep where I'd wake up in the middle of the night and have a terrible time getting back to sleep. So sleep was an issue. I would have issues with mood. I think I tacked towards the depressive side, on balance, for the most part. But as time went on with age-wise and with sleep issues becoming what they were, and just, the loss of the vitality that comes with just aging process, sad moods became exponentially sadder over the course of time. So mood and fatigue was starting to kind of add to the spiral. Add to the fact that I was starting to have like a really, really slow GI tract. So it would be digestive process would be just excruciatingly slow. It'd be like one every 3 days, and it'd be work to have that happen. So GI started to slow down. And so when I came to you, I basically showed up to you with symptoms of really low, moods, or attacking that way, or excessively low from time to time, issues with sleep, issues with fatigue. And just to back up some, the fatigue issue got so bad that I even was tested for the Epstein-Barr virus, because it'd be midday. It would be anytime between like 11 and say 2. It would be just phenomenal work to be able to stay awake, which is tough. And that's a long time to be just really, really hovering above unconsciousness. So I come to you and, we lay out, the symptoms and the like. I had experience before with supplementation with testosterone and HGH, but it didn't really help so much. Insofar as in that particular case, yes, it helped with, physical vitality for the working out and this, that, and the other. But what we did differently with you that I did with a previous doc was we attacked it, more holistically, holistic with a W, all the way around, the 360-degree approach.